Greater trochanteric pain syndrome is a very common hip condition where a patient starts to get pain around the top end of the thigh, especially on the outer aspect of the hip joint. The potential causes for this condition are multiple. Sometimes people commonly refer to as a trochanteric bursitis, which is inflammation of a bursa. In some cases, there is also inflammation of the underlying tendon surrounding the hip joint. Most of the time, we don't know the reasons for this inflammation, but sometimes there can be secondary causes like hip arthritis, knee arthritis, or people who have altered gait secondary to their arthritis in a spine. Most of our patients will complain dull ache-like pain, which is especially on the outer side of the hip. They will also find extreme difficulty to sleep on this side of the hip. Very rarely, when the patient starts to take a prolonged walk, they will have discomfort, especially on the outer side of the hip as well. Fortunately, this is not a sinister pathology, and majority of cases does not require any sort of surgical intervention. Here at BCUHB, we have an excellent team of people working for you who will carry out a thorough assessment and recommend various therapies available to you. This includes assessment and treatment by experienced physiotherapy. In some cases, it requires ultrasound-guided steroid injection, and in very rare cases, we have a facility available called shockwave therapy.